Can you die from a broken heart? Can wine make you live longer? Does cancer have a smell? And can you actually die of a broken heart? What? Today, we're back with 3 health specialists, an emergency medicine physician, myself, a cardiologist, aka heart doctor, and an oncologist hematologist, a cancer doc. Today, we're answering everything you wanted to know about cancer and the heart. Let's dive right in. Have you seen where animals can smell cancer? Does cancer have a smell?
Well, dogs specifically, and this data for other animals, that they're able to, if specifically trained, recognize patients who may have cancer. Well, having said that, in principle, they able to catch so-called volatile organic compounds, which all different diseases produce. So since animals smell thousands of times more specifically, then yes, they able to recognize some patients with cancer. Just not enough to use it as a diagnostic modality.
But have you heard of cancer having a very specific smell?
Well, I wouldn't dare to impose on the way they smell. Some of them, however, when they're really, really sick, usually you can smell something that you know associated with complications, typically kidney failure. That has specific smell, and anyone can actually recognize it. But I wouldn't rely on it.
Got it. Is follow your heart medically sound advice?
Not so much if your heart's leading you into trouble. But, sometimes follow your head may be the better advice.
Yeah, true.
So I would say outside of relationships, follow your head.
Yeah, definitely. What are the best treatments today, and how do you decide which ones to use?
So the contemporary oncology is all about tailored therapies. So even when it comes to specific chemotherapies, immunotherapies, we use specific predictive tests, usually based on a biopsy or blood testing that can tell us ahead of time if specific treatment are likely to work. And that's why you have to trust your oncologist, and if chemotherapy is the best option, you have to stick with this. For instance, for stage 4 testicular cancer, classic chemotherapy is still treatment of choice because it leads to cure in most cases.
During heart surgery, do you stop the heart or does it just keep going?
So if you're having open heart surgery, yes, you have to open the chest and you actually stop the heart, and you use a machine that reroutes the blood around the heart, what we call the heart-lung bypass machine. So on this machine, the surgeon can work on your heart without it moving, and so they can do very precise surgery on your heart.
Do you put it on ice?
It's called cold cardioplegia. Yes, you ice the heart to keep it cold and work on it, and our surgeons are very good at this.
That is super cool. And when you say you open up the chest, how do you get in the chest?
There are a variety of ways to access the heart, but the typical way is what we call a sternotomy. So it's an incision from here to here that exposes enough space for the surgeon to work, and then the sternum is just put back together with wires, and it totally heals up.
Cool. So you said stage 4. Are there multiple stages? What are the stages?
So staging is a type of a predictive tool designed to help doctors to gauge patient prognosis. Between different cancers, staging varies. In some cancers, stage 4 is completely curable. In some cases, it means that cancer spread from original location to a distant organ. In other cancers, we don't even use it in this way, and we have other predictive tools. So I wouldn't get stuck on the staging.
Does drinking wine every day actually help your heart, or is it just an excuse?
What we know now is that alcohol is pretty much a direct toxin to the heart.
Alcohol is bad. You shouldn't drink alcohol.
And there is no minimum amount that's completely not harmful, and no amount is healthy. But drinking in moderation is something you can do if you're healthy and you do it responsibly. But I wouldn't use the excuse that you're doing this as an alternative to other things that are good for your heart.
Right. Can cancer spontaneously disappear on its own without treatment, or what is spontaneous remission?
It is possible. So there's a thinking that a lot of cancers, you have mutations that have been corrected by your repair system. Some of those mutations actually can go through and create some early malignant cells. So then those cells are dealt with by immune system. So having said that, I would not rely on this. While it is possible, currently we have no way to predict in which cases those tumors will spontaneously disappear, in which they won't.
We've seen players get this thing called Commotio cordis. What is that?
To midfield and lowers the shoulder.
Commotio cordis is an interesting and extremely rare phenomenon where you have a physical impact on your chest that disrupts the normal electrical activity of your heart. So your heart can go into an electrical disorganized rhythm called ventricular fibrillation, which is fatal.
Right. That's typically what I treat. Typically, people will come to the emergency department in ventricular fibrillation, and that's when they're in cardiac arrest. And CPR works, but electricity is also what you want to use to defibrillate the individual. Stage 0, is that a thing?
It is a thing. So stage 0, we use it in cases where tumor is present, but it's not invasive enough at the moment. That type of tumor still needs attention, and it typically is addressed by some forms of surgery, actually, and with a high chance of cure.
So does genetics play a bigger role in heart disease than lifestyle? And if so, are we wasting a lot of effort on prevention?
No. Genetics do play a role, absolutely. If you have multiple family members with those early heart attacks, needing stents in their heart, needing bypass surgery, you might have genetics that lead to more aggressive plaque buildup in your arteries and heart disease at a younger age. The current belief is about probably 80% of all heart attacks preventable with diet, exercise, and lifestyle.
Yeah. Pretty easy things, all the things we always hear and say, we just have to do them. Are supplements and vitamins helpful or harmful during cancer treatments?
Well, if you think about it, cancer cells need building blocks and coenzymes, the supporting molecules, to divide faster than normal cells. So of all cells in your body, cancer cells need vitamins more. So in other words, using high dose vitamins may not help, but instead it can damage. But you still can use regular prophylactic dose of all vitamins as recommended by American Medical Association. So it is a complicated topic, but when you come to supplements, unless we know that this specific supplement is detrimental or interacts with the treatments we provide, I usually do not mind my patients taking some benign supplements.
So, are energy drinks a public health crisis, aka are they bad for your heart?
Very possibly. A lot of these drinks have, in addition to some stimulants that give you the energy, they also have a lot of sugar, which is important to avoid in excess. And a lot of the stimulants may have kind of long-term metabolic effects that we just don't know about. So an occasional Red Bull may be fine, but drinking several a day, I think we just don't know enough to feel safe that it is safe.
Got it.
We do see patients who do have some heart arrhythmias that are provoked by energy drinks, that when they drink more of them, they get more symptoms, and that is a known correlation.
Do you think low iron contributes to cancer?
Certainly, there's data that low iron create hypoxia and chronic inflammatory state that does increase risk of cancer. Some numbers put it as high as 10 times more, but I do recommend for all women specifically who may suspect they have low iron to contact their oncologist, hematologist, because I have a lot of patients who are not feeling well because of low iron.
Are cholesterol-lowering drugs like statins overprescribed? Do we really need them?
I don't think that overall they are overprescribed because statins are a very powerful drug that lowers the cholesterol in your blood. And for people who've had heart attacks, statins reduce the risk of recurrence and actually reduce the risk of death by a very significant amount. But about 5% of people on higher dose statins have some form of achy muscles, which is, it's not dangerous. And most of the time, if you tell your doctor about it, we can either switch you to a different statin that you tolerate better, or even to one of the newer classes of drugs that can give you the same heart disease benefits without the muscle aches.
Are alternative treatments like CBD oil or mushrooms actually effective for cancer?
Idea is none of these treatments directly help treating cancer, but they do help symptoms of cancer. So if you think about it, a lot of these patients are depressed. So it may help with this depression, especially if it is severe depression. Having said that, this is not current standard of care. And when it comes to CBD and products of marijuana, I routinely recommend my patients to use some form of this because we have legal version of it, Marinol, which is the essentially version of THC. So in reasonable doses, it does help most of my patients.
Got it. So in other words, along with your traditional treatments, these alternative treatments are something that somebody could look into to use.
Absolutely. If you think about it again, a lot of currently used treatments used to be alternative, including chemotherapy.
Can you die from a broken heart? Like an emotionally broken heart?
Very, very rarely, but your heart can get sick from a severe emotional distress.
Ah.
So someone who's lost a family member, sometimes they don't feel well, and we do an ultrasound of their heart to look at it, and we can see the heart is beating weakly. And this is a specific thing called stress cardiomyopathy, caused by a sudden release of stress hormones in the body, and usually is temporary and reversible.
Yeah.
And treatable with medications, but it can be fatal in very, very rare circumstances.
Interesting. Sometimes you hear it called broken heart syndrome. There you have it, answers to some of the most pressing, puzzling, and downright thought-provoking medical questions about cancer and your heart. A huge thanks to my buddies, Dr. Vlad and Dr. Kumar, for lending their time and expertise. It's not every day you get to sit down with such brilliant minds in both oncology and cardiology. So thanks to them, and do you have more medical-specific questions that you want us to tackle, or other specialty doctors you want to hear from? Please let me know in the comments. I want to make the content that you want. So please send me your ideas. And if you enjoyed today's video, please binge watch this playlist right here and hit that subscribe button, turn your bell notifications on, and share this video with a friend who could benefit from it. Thank you so much for watching, and stay healthy, my friends.